Hey, Mike, it's great to reconnect with you today, and thanks for spending some time with us. For our listeners, I'm Dave Gutillo, Director of Field Market Innovation for Healthcare with Ascom Americas, and I'm excited to be joined today by Mike Brandofino, who's the President and Chief Operating Officer for Caregility. Mike's got over 20 years of experience in both audiovisual and unified communications, spanning both enterprise and healthcare. And for those of you that don't know Caregility, they're an industry leader in both telehealth and virtual care, with over 1,000 hospitals and health systems using their platform and services, 5 million virtual sessions annually, and over 30,000 telehealth devices deployed in North America market. Mike, anything you'd like to add before we get started with our questions?
Thanks for having me. I appreciate joining this. I guess the thing I'd like to add is that most people are used to virtual care being kind of that outpatient setting where patient sees their doctor for a couple of minutes and gets a prescription. We started from the beginning focusing on what we think was the hardest part of virtual care, which is the ICU in the inpatient setting. And I think that's what makes us different in as we talk about virtual nursing today, why it's such a unique approach.
That's great. I'm excited to dig in with you. This is going to be a good conversation. So, there's a lot of conversation and discussion around virtual nursing today. And, it's been around for a while, certainly proliferated during the pandemic. But what's great is that it continues to evolve and expand based on, of course, a number of dynamics within healthcare delivery today. I've read up on Caregility, and I understand that your theme is connecting care everywhere. And I'd really like for you to expand on, what you see as the most impactful benefits that the virtual nursing models are bringing to healthcare delivery today.
Sure. And I'd like to add to that kind of our true north, which is empowering caregivers. The way to enable virtual care anywhere is really to empower the caregivers. And I think virtual nursing is chock full of benefits. The industry has faced staffing shortages, retention challenges. Nurses aren't able to practice up to their highest certification because they're doing kind of mundane tasks every day that they have to do, and therefore not able to kind of leverage their certifications and focus on the patients from that perspective. What we've seen with virtual care is we're giving time back to those nurses, those floor nurses, by taking away things like discharges, which is one of the first kind of low-hanging fruits with virtual care. If you can have a centralized core of nurses doing discharges and discharge education, you're freeing up those floor nurses. If you can just free up 20 minutes a day, that gives them more time. But what it's also done is extended the career of experienced nurses. We have some great stories of nurses who bad backs, bad knees, not able to be on the floor anymore, about to retire, got cycled into the virtual nursing program, and you get a double benefit. You get to extend their career, but you get to keep that experience. So now, less experienced nurse walking into a room, never doing a burn patient, change on the bandages, can call an expert. And so you give them more confidence, you give that extra training, and you keep that experience in your health system. And so that all, really are some of the benefits that are incredible. One of the ones that we didn't expect was the huge increase in patient satisfaction. And I think early on, a lot of people thought that virtual care was taking out kind of that personal relationship with patients. But actually, it's the converse is true. What we're seeing is because the virtual nurses don't have that shoulder pull, they don't have that code that they need to go run to, they're actually establishing a better rapport with the patients, which is leading to the patients feeling better about the care they're giving, and the patient satisfaction scores going up. So all around, virtual nursing is definitely increasing benefits.
That's great to hear. I won't date myself by saying how long it's been since I was a practicing clinician, but I'm glad to hear that we're able to keep nurses engaged and working at the top of their license while helping out with nursing staff that may be a little bit younger. It's encouraging, and it actually validates a survey that we recently did to over 500 nurses. And we asked them about what hospitals and health systems could do to help not only relieve nursing shortages, but also improve nursing satisfaction. You talked about patient satisfaction a good bit, but on the nursing satisfaction front, one of the key findings is that it's really important to have a technology strategy that targets nursing satisfaction. In fact, of the nurses that we surveyed, over 60% of them said that the hospital suite of technology was a critical indicator in deciding where they wanted to work and stay employed, right? So I think that that's a really important piece of what you do. And then a couple of themes came out from that survey too that I think are worth mentioning because it dovetails nicely into what you're being able to do. One was that it enabled this idea of more direct patient care and engagement with the patient, allowing the nurses to spend more time with their patients. So whether it's virtual or in person, I think it promotes that from the patient's perspective. And the other one, of course, was really kind of shifting care delivery from being reactive to more proactive and predictive. And I think, given what you guys are doing, and I'm sure about this soon, this idea of really empowering the clinical staff with the right kind of context in the information. So it sounds like Caregility is really enabling that on both fronts. So great to hear. So you've been doing this a while, Mike, and when you do this, you become what I would consider to be an industry expert and an advisor in the delivery of these type of models. So I'd love to hear from you. What are some things that hospital decision makers should keep in mind when they're thinking about virtual nursing and a deployment strategy?
I think the first thing is understanding the culture. That what is their acceptance to change? That tends to be one of the biggest sticking points. I think the other one is to not try to boil the ocean. Let's find quick wins. Let's find the pain points and things that are distracting the nurses from doing, practicing to their license or focusing on the patients and tackle those. That's why discharges tend to be one of the quickest ones that you can do. You could literally do it on an iPad with a camera if you want to go that low to get it going, and you could get some serious benefits and you can start capturing some good metrics with that. So I think understanding fit into the understanding the culture of the organization, and also creating a team dynamic. The customers that we saw most successful did things where they didn't just have a centralized core of virtual nurses. What they did is they had a couple of those, but they also cycled floor nurses into the program every couple of weeks. And what that created was a team dynamic. So it's not us and them. It's they're all part of the same team. And it wasn't Big Brother looking over your shoulder checking on you. They're an integral part of the care program within that floor, within that system. And so I think it's really important to think about those different dynamics. I also think that a lot of customers focus on technology, and we'll talk a little bit about this later, but I think it's more about workflow. Understand how this is going to fit into the workflow of your team and not try and just position it as a technology play, because I think that's where it starts falling apart. And again, the most successful programs we've seen with our customers is when they've done that and also blended, experienced and newer nurses into the program and really offered that guidance in a way that gave them more confidence. We have nurses on staff and they tell me the horror stories of their first weeks and how nervous they were and making a mistake. If you could call an experienced nurse and have that nurse help you through some of the first things that you do, boy, that really improves the confidence. So I think these health systems really need to figure out what's the low-hanging fruit, figure out the workflow, and also capture the KPIs. What are you trying to capture? In one of our customers' instances, their stated goal was to reduce discharges from, I think it was 3.5 hours on average, to under 3 hours, right? So that was the initial goal. They actually got them to under 2 hours because as they went through the program, they figured out ways to improve the education piece. They figured out ways to be prepped before getting a patient. They were able to get all this savings which they were able to then look at and see how the success of the program was going.
That's fantastic. I appreciate a couple of things from those comments. One is that never underestimate the power of culture, right?
Right.
And just what needs to be done in order to align your business strategy with that of your clients. And then the other that you mentioned was the idea of low-hanging fruit, but gotta have measure. And this idea of having KPIs in place, I think, is really important. In our own business, we utilize methodologies, as I'm sure every healthcare provider does, to really make sure that we're assessing the qualitative and the quantitative aspects of value that we bring pre and post delivery. And just as you mentioned, I think the client success is both continuous and iterative. It's not one and done, right? We've got to stay plugged in. We've got to be able to co-create, got to be able to optimize the solutions as the client's needs change over time. And I think, you're proving that. We're proving it together, right? One example that I can point to is that, we recently partnered with an IDN and a virtual nursing provider, wherein they simply wanted enablement of the virtual nursing activation through the Ascom Nurse Call Pillow Speaker. And we were able to do that. It was low-hanging fruit, it was incremental, but it was a huge value satisfier, and both for the clinicians and the patient. And so I forward, we're probably going to see more, I don't say probably, we will see more platform convergence and more collaboration like this, where we try to address the needs of both the patient and the staff alike. So really appreciate your perspective on that. So speaking of moving forward, let's talk about the future of virtual nursing, right? So there's all kinds of stuff going on. There's functionality changes. You guys are trying to scale. We're trying to scale. How do you see virtual nursing into the hospital technology ecosystem?
Well, first, I want to make the statement that we should not be talking about replacing nurses. I'm sure folks have seen or heard that, the Kaiser nurses really getting upset about some of the AI technology that they're trying to implement. And I think it's all around kind of the terminology being used and really how it started. We shouldn't start with technology and then trying to figure out what problem it's going to solve. We should really be looking at the day in the life of a nurse. I keep using a nurse because they're the biggest component of the care in an inpatient setting, right?
Yep.
And understand the challenges that they face and what the staffing issues are causing and what things they're doing on a day-to-day basis. And then let's go from there. And I really like to think of it in terms of clinical. If we could provide more information about what's happening in the room and take those pieces together and synthesize them in a way that makes it easy for someone to evaluate, I think that's where we're going to get the best benefit and extend the virtual nursing to the point where you can increase the ratios. The whole idea here is, again, how do you take the you have and deal with more patients in an effective way? And so I think that gathering data, whether it's contactless vital signs, or it's motion happening in the room, or it's the position of the bed, the things that nurses have to check every day, can we give them that information without them having to walk in the room, so then they can assess where to focus their time? And I think those are the types of things that will layer on, fit into their work, provide potential trending information, and I think ultimately lead to improved outcomes with the patients and a better quality of work for the nurses.
Yeah, so true. I'm so glad that you mentioned the proper place of data and AI in the context of just not deploy technology for technology's sake. We did another survey last year. We had 950 clinicians this time, and we asked them to rank in terms of what was most important to them, elements of clinical decision support systems. And I bucket to a certain degree AI into clinical decision support systems. And what we found was really pretty impressive. I mean, some of it was not without understanding already, because we hear it all the time. But it was the idea of, look, we really want to implementing. We want help with workflow redesign. We want it to help with documentation reduction. We want it to help with alarm fatigue reduction, and we want to automate workflows. And you mentioned the Becker's article and Kaiser. I think there's real concern today that data proliferation and AI could actually impede some of the progress that we're trying to make in and around those attributes that I just mentioned. You guys seem to really be doing a job in coalescing information and bringing that single pane of glass, to the clinicians, so that this idea of informed decision making and care delivery, it really becomes much more relevant. And I also wanted to just make a comment, because I just read this last month. The AMA House of Delegates actually is now using the term augmented intelligence instead of artificial intelligence to really focus on AI's assistive role in emphasizing that it's really designed to enhance human intelligence rather than replace it. So thank you for saying this is not about replacing clinicians, because that's the last thing that we want to do. Just because we can when it comes to technology doesn't necessarily mean that we should, right?
Yeah. And I would argue that most of the AI that people call AI is really just gathering data. Mm-hmm. And it's not the intelligence on making deductions and looking at the trend and predicting something, right? That's where the AI comes in. But I think gathering the intelligence and synthesizing it in a way that makes it digestible, is really the most important part of it.
Yeah, absolutely. This has really been an insightful conversation. It's actually been a lot of fun too. So it's great to speak with you again. And I think our audience should have some great takeaways from what we're seeing as the ever expanding and crucial role of telehealth and virtual care, and how it's solving for so many problems in healthcare delivery today. I'm truly excited to see what the future brings, and I really appreciate the level of collaboration that Caregility and Ascom in this way and in the future too. So thanks again for your time, and again, look forward to working with you more.
Thanks for having me, and I look forward to working with Ascom as well.